I have record. I don't know if it's recording. Okay.
It should be recording. Please click on record.
Okay. So here we go. Unique benefits of auricular medicine. Thank you, Nawaz. Thank you, Scientific Guild. These are great seminars, so thank you much. And now, okay, good. So I'm going to tell bio what is auricular medicine diagnosis, and then illustrate the unique benefits by talking about cases and be available for questions. So my background, I have doctorate in Chinese medicine, masters, and so on. Former faculty of ACTCM, one of the oldest TCM schools in the United States, and a disciple of Dr. Huang Lichun, who was called the #1 in the world in auricular medicine by the World Health Organization. And I founded the Institute of Auricular and Transcendental Medicine. That was a bad picture. There's a better picture later. So what is auricular medicine? So within the field of traditional Chinese medicine, we have microsystems. A microsystem is an area of the body that can represent the whole body and all the, everything in the body. So for instance, reflexology is the microsystem on the foot. And when you get a massage on the foot, it is also massaging all the organs, and it relaxes the whole body because it is a microsystem representing the whole body. There's a microsystem, the Korean hand acupuncture microsystem. There's scalp microsystem, which is incredibly useful for neurological conditions. But the auricular microsystem is the most sophisticated, researched, and developed microsystem. Why do I say it's that sophisticated? Because, for instance, I have a patient who has an unusual condition, I can't remember the name of it in Western medicine, where he would get these little polyps that would bleed and anywhere in the body. And the only way to stop the bleeding is that for Western medicine would be to cauterize it. And so, he came one time with a little polyp on the lip, and with auricular medicine, I can locate it and I can treat and I can stop the bleeding. As our previous lecture was very interesting, and the previous lecture demonstrated through a lot of Western research the efficacy of the point at causing physiological effects. Well, with auricular acupuncture, we can increase circulation anywhere in the body. We can decrease circulation. We can stop bleeding. So he also had, these would not be stopped unless they were cauterized. So he was subject to severe anemia, to where he had to have blood transfusions. So he was having some of them in his intestinal tract. Western medicine would have to have very invasive procedures to locate them and cauterize them. With auricular medicine, I can diagnose on the ear, locate them, and stop the bleeding. And it, in this case, turned out to be in the small intestine. And then he can go to, he can feel that the treatment has been successful because he feels better, but he can go back to his doctor, test his blood, and see that he is not losing blood anymore, and his anemia, and also Chinese medicine treats anemia. But that level of sophistication is what I'm talking about with the auricle, with the outer ear. So it is incredibly sophisticated. Okay. ear acupuncture has a long history, which I'm going to talk about briefly. Auricular medicine is a term coined by Dr. Huang Lichun to distinguish it, because auricular medicine is using both diagnosis and treatment. So a physician that understands auricular medicine can treat but most conditions coming in the office can be treated just by auricular medicine. So that's the term. The history. So the Huangdi Neijing used to be dated to about 2,500 years ago. And then there were findings, writings in the Ma Huangdui burial site that is dated to over 7,000 years ago. So these writings that I'm quoting here relative to auricular medicine date back at least 7,000 years. So this one is in Chinese, 是好恶以知其性. So one can look at the ear and determine pathology or health and the nature of that pathology and health. And that is like over 7,000 years old. And then all 12 channels go to the ear, either directly or indirectly. And so the meridian system, the meridian system that we use, the main meridians are going directly to the ear. And so as a Chinese medicine doctor, you can treat the meridian system of the body. For instance, you would likely use the lung and large intestine meridians to treat colds, flu, COVID. You can do that on the ear and use just the meridian system of the body through the ear and points on the ear, or you can use just the body alone, or you can combine the two and get even more dramatic effects. And so
Dr. Sawyer, your microphone is muted.
sorry.
There
Okay.
you go. Okay.
So these pictures are showing in ancient books examples of using the ear for healing. So moxibustion, herbs, acupuncture, thousands of years ago. And then this is a picture of Dr. Huang Lichun and her mentor, Dr. Xu Zuolin. Dr. Xu Zuolin gave about 45 years of his life to auricular acupuncture. Dr. Huang Lichun gave about 45 years of her life. And so Dr. Huang Lichun was a Western trained surgeon and anesthesiologist in the military. Her whole family were Western trained. And then she hurt her finger. At one point, her commanding officer threw her into a class with Dr. Xu Zuolin, and he was teaching auricular acupuncture. He contributed a greater understanding and points on the ear in the early 50s. Dr. Huang Lichun contributed an enormous amount. There was research at that point all over China. Let's go to the next one. From 59, there was research before and after, but say from 59 to 2001, about 1,300 research papers and reports, millions of patients involved, and this is all on auricular therapy. Most TCM doctors have some auricular acupuncture knowledge and use it in some, at least minimal ways. And so Dr. Huang Lichun was part of that movement of collecting all of this information all over China that information went into creating the Shanghai map, which I feel is not that accurate and therefore not that clinically dependable. Dr. Huang Lichun developed her own map based on this, but she was the head of a military hospital in Beijing. Much better picture of us. 301 military hospital in Beijing, and she was Western trained and she had access to all the resources in the hospital. So she directed clinical research similar to that which Dr. Shang was just talking about, you know, Western research, where, for instance, she would measure stomach acid in the body prior to using an acupuncture point, then using just that one acupuncture point, measuring the stomach acid afterwards. That kind of research that really about a minimum of 500 clinical cases per acupuncture point that really makes the understanding of those points very dependable. That's, you know, her contribution. She also gathered much of other people's research, organized it, systematized it, wrote 22 books, and taught all over the world. So her contribution is immense. She also created the map for diagnosis and systems for diagnosis that make diagnosing usable. So that's so she coined the term auricular medicine being both diagnosis and treatment. So auricular medicine is a complete system of medicine because you have both diagnosis and treatment. It is really integrative. So combining TCM and Western medicine, for instance, I gave a paper on effects of pollution and amelioration with auricular medicine in 2012, I think, in Taiwan. And what I was finding clinically is, for instance, somebody comes in with a certain condition I'm treating with Chinese medicine, it's improving, but it is not improving to the level I would expect. And what I found very often with these patients was endocrine system irregularities. And so either hypothyroid, hyperthyroid, overactive adrenals, or just an imbalance in the endocrine system, which can be diagnosed with auricular medicine and treated with auricular medicine. But obviously, you know, treating the endocrine system in this way is a Western perspective, which I would do, which would then go back to treating with TCM what their original complaint was, and they would have massive improvement. So it really lends itself to integrating in a very useful way both TCM Western medicine. It's based on the microsystem of the auricle. It uses two systems within the body, neurological and the meridian systems. And so I have a different perspective from Dr. Shang, our last speaker. Very important nerves go to the ear, to the auricle, cranial nerves. So in discussing migraines, so I've had great success with migraines with auricular medicine. Trigeminal nerve goes to the ear and can be accessed directly. And so, you know, migraine cases are very complex because it's rare that there's one cause. Usually there's a combination of many causes. So they're usually very complex, but there is a neurological component, and that can be addressed directly with the ear. So, and why auricular medicine effects can be instantaneous, I think, is due to the neurological access. It also, the auricle can access central nervous system. It's really very powerful. For instance, burns. So a patient, you know, I had a burn. I went to Western medicine years and years before Chinese medicine, and it was a hot oil burn cooking. And they put my hands in ice water, which is the worst thing to do from Chinese medicine perspective. And I was just howling in pain. The ice water toned it down. I was still in really horrific pain, and I think I was in pain for close to a week. It was an unforgettable experience. If someone comes in my office with a burn, I can put 3 needles in and the patient will be out of pain within seconds. That is because I can locate nerves directly in the ear, and the patient's out of pain within seconds. And if they come in before they have whatever they're having, by the next day, the hand will have no, will show nothing of the burn. The next day, it won't even be red, and there will be no pain. If they already have blisters, then it will stop the blisters, but it removing those blisters is the process the body has to go through, but there will be no pain. So that is the neurological system. I've already discussed meridian system a little bit. So it's sophisticated, developed, research, and systematized substantially due to Dr. Huang. Auricular diagnosis uses both allopathic anatomy and physiology and TCM anatomy physiology to diagnose. So for instance, and why is it useful? For instance, I had a patient come in with low back pain, and she had gone to her doctor. The doctor ruled out anything else and said it was just musculoskeletal. So she came in to me. I did auricular diagnosis and found that she had a kidney stone. And she said, I've never had kidney stones. It's not a kidney stone. I said, well, I'm going to treat kidney stone. I'm not going to treat low back pain. So I treated kidney stone. She was in so much pain. She was screaming to get on the table. Half an hour later, she gets off the table without any pain and goes to work. And at the end of the day, she calls me, do I need to take the herbs? I said, of course you do. But she was out of pain and the pain never returned. So auricular is so sophisticated that I can not only diagnose a kidney stone, but I can locate the sphincter and open, release, and relax that sphincter enough to pass the stone without pain and without other intervention. So I can reveal the state of the pathological process if the disease process is advancing or retreating. So I had a patient who came in for allergies. And, if I didn't have auricular diagnosis, I would just treat allergies. But because I have diagnosis, I'm finding that there's also inflammation in the GI tract, upper GI, and that it is in the beginning stage. The patient didn't even have any symptoms. So when I relayed this information to her, she said, well, I'm fine. I have had no symptoms. And that's because the disease process is very, it's the initial process, and I can see that on the ear. So I deduced that this was an effect of the allergy medication that she was taking, treated her allergies. She stopped taking the medication. And, I'm certain that the condition would improve. But with auricular medicine, I treated the beginnings of gastritis and resolved it. So you can see when you're diagnosing, is this a condition that is actually the body is already healing and it's not in need of treatment? Or is this a condition that is coming on, the patient has no symptoms? For instance, next, it can reveal pathology long before their symptoms and long after a precipitating event. So I had a patient come in that was not local, and I did the analysis, the intake, and found that there were tiny irregularities on the liver and kidney and high blood pressure. And I told the patient, when you go back, immediately go to your doctor and get this looked into. The patient did not do that, but I heard from the patient 2 years later, I think it was 2 years later, they went in for, I think it was low back pain, and had an MRI. And the doctor said the MRI found little white growths on kidney and liver. And they were too small to do anything with, but they needed to be watched. That's 2 years later. Client still didn't have symptoms. If that was my client locally, I would have treated what I saw and resolved it so that it wouldn't be growing. This is real preventive medicine. And then long after precipitating event, I had a patient come in for depression and menopause, or perimenopause at the time. And but doing the elaborate intake that I do, that's looking at all the biosystems, I noted that there was an old head injury. And what I've found over clinical experience is that when I find an old injury, it's because it hasn't yet healed. And if it hasn't yet healed completely, that area is taking energy from the body. And also that area is prone to more either pathology or more accidents, depending on what type of issue it is. And so, so even though a patient doesn't remember this, I found on this patient a head injury that happened when the patient was 9 years old. And as a result of that head injury, the patient had very restricted use of their whole left side, and cognitive symptoms, and facial nerve was damaged so that the face was a little bit contorted. There were a lot of issues, but the patient was used to it and hadn't wanted to deal with it. So I treated depression and perimenopause. And then a few years later, the patient was having headaches and came back and allowed me to treat the old head injury. I think the first treatment, the patient was able to move the toes on the left side that they had not been able to move since they were in their 50s at this point, since they were 9 years old. Treating the facial nerve, you could actually see, it was actually this area, you could see it start to relax and unwind just by locating the facial nerve and treating the facial nerve on the ear. That's how sophisticated it is. And the symptoms that are, almost, or they're 40 some years old, began to heal. Cognitive symptoms improved. So it's very sophisticated, and it's amazing. It's able to provide a baseline for treatment, reveals treatment progress. Obviously, if I can see the condition, I can see that it's improving or not. And it helps it helps the accuracy of my treatment and how I treat. It informs my treatment process, right? So this is an intake with auricular diagnosis. All of the biosystems that you see here, whoops, I can't go backwards. Oh, anyway, all of those biosystems, including the endocrine system, including the limbic system, so that I can see on the ear conditions like ADHD, like insomnia, like anxiety, depression. It's amazing diagnosis. The other map I ran through was the system of diagnosis that Dr. Huang created. So other unique benefits. So I talked about cooperation of allopathic medicine and TCM and the endocrine system. Also, cancer treatment. People are getting treated for cancer with allopathic medicine and they have symptoms and they come. Auricular medicine is extremely helpful. So neuropathy, extremely helpful. So you're treating allopathic and you're treating TCM framework. Also, with radiation dryness and in a sense, you're treating burns. So it's just so effective. I talked about if it shows on the air, it's not healed. For instance, gallbladder surgery. Well, you have a gallbladder condition. The surgery actually doesn't treat the underlying condition. So if I'm doing diagnosis, I'm going to, even though the gallbladder is no longer there, it's going to show me that the gallbladder is diseased, that there's a problem of pathology that needs treatment. And I will start treatment for the underlying condition or conditions, oftentimes involves liver, digestive system. And I will be treating that even though the organ itself is gone. Or for instance, somebody has phantom limb pain. And the limb is already gone, but the phantom limb pain can be treated on the ear with incredible accuracy. So even if a patient is unaware, I can diagnose and treat. For instance, an embarrassing condition, a patient came in with nervous tension, heart palpitations, anxiety. And when I did the diagnosis, I found a scrotal ligament injury. That is a really tiny area. Found the injury, and the patient told me that was riding a different bike, or anyway, the seat was different, and it created an injury, and he was in a lot of pain. And because I diagnosed it, it takes away the embarrassment. And of course, he wants treatment. I put in, I think, basically 2 needles, and he was out of pain within seconds. And the condition was healed by the following week. I find anal hemorrhoids. I find all kinds of conditions that people might be embarrassed to talk about. So, and in terms of migraines, since that was mentioned, I've already said that there are usually a lot of different reasons coming together, but because the auricle, because the cranial nerves go directly to the auricle, and then there are other nerves. The trigeminal nerve I can access the trigeminal nerve, which is very important in migraines, so that it's very effective. I had a case of shingles that I wish I had a camera and filmed it. It's just so amazing. So the person came in and their skin was very, very dark, and they were in a lot of excruciating pain, if you know shingles. And there was a nerve coming from the ear going all the way to the mouth, and there was a blister, very large blister in the mouth, and the line was red. And so I gave the patient auricular treatment. They were lying down, and watching the patient, it's so amazing. Their face, all the skin went bright red, and then slowly over time, it went back to a natural color. So that darkness was all gone. This part, the nerve itself, went to a dark red, and then started disappearing, and the swelling was gone, and the blister was reduced down to less than a quarter of the size. I mean, it was reduced to, it was still there, but barely there. And all this was going, it was just amazing treatment. So yes, the ear accesses nerves directly. And so that, I think, yes, that concludes my auricular diagnosis benefits and treatment benefits. For more information, you can go to drtruthsayer.com. It's very outdated. You can see I'm technologically deficient. So until I redo that website, I don't have, I'm working to get my lectures online. So if people are interested, check the website. Once the website is redone, there will be information about online webinars. So that concludes my lecture. If there are any questions. Let me get out of share screen. Oh, stop share. And I worked really hard to get my lecture down in time.
Yes, you did a good job.
Yeah. So
Such a fascinating form of diagnosis, as always, when I listen, you know, this is kind of, if somebody can be expert like you on this proper diagnosis, they don't need any form of labs or any, you know, go through all those.
yes, it
tests.
does. It actually, I mean, there are so many things that we don't need labs for because of the diagnosis. It's always useful to have confirmation since they're available, like the patient that had the intestinal bleeding. I mean, I sent him back to his doctor and the labs confirmed that the blood was back to normal and he was okay. So it's really nice to have it, but I didn't need it for treatment. That's what's so amazing. So, you know, so I would like someday to have an auricular doctoral program and to train people. And, you know, this medicine could go worldwide to poor countries and you can treat without, you know, very expensive modern day equipment. It's not to say that that equipment can't be useful. It's just that this is a modality can treat without it, which is fantastic.
Yeah, I have been listening to the presentations like you, that, you know, a lot of people around the world need these modalities. People don't have money for pharmaceuticals anymore. People don't want to go with pharmaceuticals anymore. But the problem is, I know who you are, you know who I am, but not the world knows. That's why we created different platform along with this platform to come together and just bring it to people. So that's why, you know, you missed the first day and second day, but I mean, we talked about our platform, all the faculty talked about that. So people around the world need these modalities. So where wherever the way that you can bring it to people, it's our responsibility. So I got to the point that make it responsibility now. It's not only knowledge you have, it's not only your expertise on that, but you are responsible for that too. We shouldn't forget that commitment. So this kind of philosophy, this kind of medical approach should go to everyone that they cannot afford even homeopathy, they cannot afford even any other modality. So this is something that we should do. Thank you so much.
Yes, you're welcome. You're welcome. Yes.
Dr. Truthsayer,
yes.
I'm fascinated by your talk. A lot of your diagnoses seem to be made by observations, and you were telling me you make diagnosis from the ear. Could you elaborate how you approach your diagnosis?
Okay, so the diagnosis is approached by visual. So Dr. Shang was talking about morphological changes that are connected to disease. So we look at the morphological changes on the ear, and that is one indication of disease. So for instance, when the heart when the heart is swollen, you can actually see that on the ear. When the liver is swollen and it's bigger than it needs to be, I can actually see that on the ear. So so part of it is visually looking for morphological change. Part of it is feeling for morphological change. So I have an instrument that I'm touching the ear, and it's, you know, years of training, clinical experience to know what is normal, what is abnormal, and exactly what that means. And we're also looking for things like color. We're looking for changes in color. We're looking for changes in size. We're looking, you know, anything abnormal, but then also sensitivity. So, you know, when I'm barely touching and the patient is wincing, that the patient is in a lot of pain, that indicates, you know, pathology in that area. So, and then I have an instrument that measures the electrical discharge of the area. That also gives me information. So there are numerous factors that I'm looking at as I'm going over the ear minutely. And I'm looking at, personally, the way I do it, you know, I have a tradition that's been handed down. Dr. Xu Zolin, his focus, Dr. Huang Lichun, her focus, my focus, because I practice something called transcendental medicine, is very holistic. So I always, I don't treat chief complaint. I treat the whole system. So I'm looking at everything that contributes to that pathological issue. So even if it's just migraines, I'm also looking at what are the psychological issues that maybe, if there are or not. You know, I've had some patients with a lot of psychological, I've had other patients, for instance, from the military that that had psychological issues that were affecting it, but the cause was military accident, was trauma to the head. You know, so there it's very complex, but I can deduce all of that by looking at the whole, every system in the body and how that relates to the chief complaint.
So in other words, you look at the physical properties
Yes,
and the thermographic properties.
yes.
So do you make use of a thermogram, for
Mm.
example? Thermogram is to detect the increased blood flow to that particular area. Do you make use of those items?
Well, I think thermography, that's what you're talking about, right? Thermography.
Yes, yes,
Yes.
yes.
I think you know, the benefit of thermography for me would be before and after treatment of the area. So I wouldn't use it for, this area is very small, very, very tough to use thermography to help in diagnosis. But if I'm treating an area, I mean, for instance, I would be treating the migraine, for instance, we could do thermography of the whole head area prior to treatment and then post-treatment, and it would document the benefits of the treatment. So thermography is really useful at documenting the changes that are happening in the body as a result of treatment.
Good. Thank you very much.
You're welcome.
So, yeah, thank you so much again.
Yep.
I think the conference is, Dr. Trusayer was the last presenter. So, but we have discussion now. I would like to go back to Professor Zai, that I had something to say.